Hi, Dr. J here. So you received a kidney transplant. How do you prevent your body from rejecting it? Let's learn. We are surrounded by germs, and these germs include bacteria, viruses, fungi, parasites, and even some cancers that act like an infection. It is the job of the immune system to protect us from these attacks. How? Well, let's go inside a blood vessel. Swimming in the bloodstream is an infecting germ. Very soon, immune cells show up and attack it. So let's consider a kidney transplant. The transplanted kidney is not your own, so it's a foreign organ. But anything foreign in the body is interpreted to be an infection. So as we discussed, this activates the immune system, whose job it is to fight infections. So the immune system and its cells see this foreign organ, which to them looks like an infection, so they attack it. If we let this happen, the kidney is damaged by the immune cells. This is what is meant by rejection. So what we want is for the immune cells to ignore the foreign organ. For this, we use drugs that put blinders on the immune cells. Thanks to these drugs, the immune cells cannot see the foreign organ, which is then accepted and therefore can function normally. We start out with immune cells. After giving the drugs, we end up with a suppressed immune cell. So the drugs are called immunosuppressive medications, and these prevent rejection of the kidney. So what happens if you don't take your immunosuppression? You guessed it. If you don't take your immunosuppressive medications, the blinders come off the immune cells and rejection of the kidney will occur. This can occur at any time after the transplant, although with time, lower doses of immunosuppression are often sufficient because the immune cells get used to the kidney. So what are the effects of immunosuppression? When a normal immune cell encounters an infection, it attacks. When an immunosuppressed immune cell encounters an infection, it can still attack it, but the attack is weak, so the infection may be difficult to fight. So does this mean I'll get a lot of infections if I get a kidney transplant? Not necessarily. It's a matter of balance between a normal immune system, which can fight infection, and a suppressed immune system, which avoids rejection. If the immune system is not suppressed, it fights infections well, but it will also reject a transplant kidney. If we completely suppress the immune system, it can't reject the kidney, but it also can't fight infections, which is dangerous. So we need a balanced immunosuppression where both infections and rejection are prevented. And with our current knowledge, this fine balance can be achieved. So the immune system is very complicated. I'm going to give you some idea how we do that. I mentioned all the different types of infections our immune system protects us from. So let's look at the immune system. The immune system handles each type of infection with a corresponding cell. So you could say that different immune cells are assigned different types of infection. So if we can figure out which cells are involved with rejection, maybe we can target those and leave the rest of the immune system intact. Turns out that the T cell or T lymphocyte is the immune cell that is mainly responsible for rejection. So modern immunosuppression mainly targets the T cell. That way, a lot of the immune system is spared and can fight other infections. But T cells do have an assigned infection to fight as well, and they can't fight this very well. So what type of infections do T cells fight? T cells fight certain viruses like CMV. In a person without immunosuppression, a CMV infection is like a cold, but it can be more serious if you have suppressed cells. In that case, the virus can multiply out of control. So how do we deal with that? We help the immune system by giving antiviral medication, and this reestablishes the defense, and now CMV is not a problem. So I've simplified things, but you get the idea. Using these strategies, we can find the right balance to accept the kidney without life-threatening infections. But it's a complex process with a lot of moving parts. So how do we manage this complexity? You will have a dedicated team caring for you, each person with a different expertise, including, of course, a transplant surgeon and a transplant nephrologist. But there will also be a pharmacy doctor who specializes in dosing medications and preventing side effects, a social worker to help navigate the complexities of insurance, and a dietitian to help get you proper nutrition. And most importantly, you will have your own transplant nurse who will get to know you very well and be your go-to. But these people will all know you and will become like a second family. To monitor you early on, there are frequent clinic visits, maybe once or twice a week in the beginning. But after a few months, they will be a lot less frequent, maybe every few months. And if you live far, we may even be able to arrange ways of doing them locally. Also, once things are stable, fewer clinic visits are needed and can be replaced by blood tests. And of course, blood tests can be done near home, which is much more convenient. But things can change. Previously tolerated medications can have side effects. Or you could get an infection like a cold that might activate your immune system, which then disturbs the balance between infection and rejection. The key to success is communication. Unfortunately, we've had patients, luckily very rare, doing perfectly well who mistakenly think this means they're all set and can avoid follow-up. I can see how that might happen, and I understand people are busy. The problem is, when the patient does finally show up, the kidney may be too far gone, and it is too late to do anything except start dialysis. I consider this tragedy a failure on our part to educate these patients. So one goal of this video is to communicate the importance of staying in touch and continuing regular monitoring and follow-up. Most patients, however, will cherish their new kidney and honor this incredible gift, and they will go on and have an amazing life-changing journey with their new kidney. Thanks for watching this video.